There we go. Hey, what's going on? Oh, is my microphone on? Oh, there we go. What's going on? Charles Austin here, and let's be fit forever. Sorry about the start there. Let me get my chair a little bit lower, get closer to this microphone. Yes, Fitness Charles is here, talking about cancer today. So, I started a series on what is cancer not too long ago, where I basically introduced cancer, kind of explain what it is, how you get it, and some of the different types. A couple of little nuggets on common causes and prevention, but it was basically an overall introduction to what is cancer. Because really, like I said in the previous video, it's something that we know about, but we don't really know about, if you will, right? So again, if you haven't seen that video, check that video out. I put a link in the description of this video to part one of my series on what is cancer. But again, today we're going to talk about part two of what is cancer, and specifically about how it kills you. All right. As always, though, before we get started, make sure that you are liking this video. Make sure that you are subscribing to the channel, turning your notifications on so that you're up to date with the latest content here. And always make sure that you're sharing this video out. Like, share, subscribe, if you're liking the content here on the channel. All right. So we're going to get started, and I'm going to share this link out real quick. Let's see, where is it? There we go. I'm going to share this out real quick, y'all. Get it out there. Let's see. Happening now. Yeah, there we go. Okay. All right. I had to share that out real quick. Sometimes when I do streams, people are like, well, you didn't share it out. I'm like, well, if you were subscribed, you would know that I was making a video. If you were subscribed and your notifications were on, you would know I was making a video. But again, people would be like, hey, why didn't you share it out? So I shared it out. So we'll see how that goes. But anyway, again, like I said, we're going to talk part two today. You know, I don't like to waste time. We're specifically talking about why cancer actually kills. So picture here on the side, I don't know who that guy is, but it looked like it was perfect for the stream, right? Today. And let's dive on in. So first off, how does we know cancer can be fatal, okay? You hear the word cancer, it's not something that you want to deal with. It's not something that you're like, yay, yippee, cancer. Nobody has that reaction, right? We know it's something that is dangerous, can be fatal, can be very debilitating. But how does this actually happen, right? So a couple of things real quick that I was able to find is that, number one, cancer, as it says here, it's not necessarily always fatal, like specifically cancer. Okay, and we'll get into that as we go throughout this video today. But it's not always necessarily fatal, but obviously many people do die from cancer, like literally cancer caused their death, right? But there are other things that could also result in someone's death, right? So it could be organ failure, right? Depending on where the cancer is, how aggressive it is, and the size of the tumor, right? And depending on which organ it's attacking. So again, we're going to get into that a little bit in just a second, right? Could be, think about this, a lot of different treatments that are involved with cancer. There's different therapies. You got chemotherapy, which I'm sure everybody is well versed in, or at least they've heard of it, what chemotherapy is. But there's radiation therapies. There are immunosuppressive therapies, immunotherapies. There's surgical removal of tumors. So there's lots of different treatments for cancer, depending on where it is and how aggressive it is, right? So sometimes you might actually have complications during the actual surgery to remove these things, because everybody's body responds differently to surgery. So again, surgery is not something you really want to have ever, unless it's an absolute emergency, right? look at this one here. Sometimes, depending on how large the tumor grows, organs can actually rupture because this tumor gets so large that it's pushing other things out of the way and making a new home where vital organs used to be. And now we're having an issue with organs rupturing, tearing, and bursting and things of that nature, which can actually result in death as well. And then look at this one here. And this is a big one. This one kind of reminds me of HIV, right? Of course, HIV, human immunodeficiency virus, which can progress into AIDS, acquired immunodeficiency syndrome, right? So what HIV does is it literally attacks your immune system, right? So most people who, die. Uh-oh, my light is flickering. Hold on, y'all. There we go. Sorry about that. I'm back. But most people don't necessarily die from AIDS, or HIV. It's something like the flu or pneumonia or even the common cold, something that you catch and your immune system's so weak, well, now you can't fight it. So as it says here, infection due to the immune system's ability to fight off illness while on cancer treatment, right? So then this should have said, this would have been worded better if it would have said infection due to the immune system's inability to fight off illness, right? So when your body is so preoccupied, number one, your immune system is literally trying to figure out what's going on with this cancer. It's trying to fight that off. So it's kind of like distracted when it's trying to fight off cancer, right? Think about also any of the therapies that you could be going on if you're a cancer patient, and now you've compromised your immune system even further. So some of those are some of the ways that you can actually die from cancer, right? So again, whether or not you'll die if you have cancer depends on several factors. Stage of the cancer, all right? We'll do that in just a second. And as it says in an example, terminal cancer, as it says in the definition, terminal cancer, at the end of the day, for the most part, cannot be cured or treated, okay? So depending on the stage is a big deal with determining whether or not you're going to be able to survive cancer, right? Any type of cancer can become terminal or fatal cancer, which means the person will die from it, okay? So this is kind of a little breakdown, and we'll do this on another page in just a second, but kind of a quick little introduction before we move on to the next page. But depending on the type of cancer, right? So depending on the type of cancer, the cause of death can vary. Here are some more details on how cancer can cause death, right? So what if the cancer is in the bones, right? One of the examples here is malignant hypercalcemia, which is one of the more common disorders found in patients with advanced stage cancer, and this is affecting up to 44% of patients, right? So as it says here, as cancer advances, some of the cancer cells find a way into the bloodstream, which is not what we want, because as we know, our blood goes everywhere, right? If cancer is getting into the bloodstream, now it has the ability to move throughout the body at will, right? When this happens, these cancer cells can easily... See, I'm always ahead of myself. But again, these cancer cells can easily travel throughout the entire body. So many patients with advanced stage cancers will experience malignant hypercalcemia because of the high amount of blood flows that runs throughout our bone marrow every day. And if you don't know, bone marrow is a blood cell. It helps make blood cells, okay? So that's something that's a little bit more serious, right? Brain. Okay, so again, brain herniation is a common occurrence for those who have cancer. All right, brain herniation is possible for both with cancer originating in the brain or cancer which has spread to the brain. So all they're talking about here is at some point, they're saying basically whether the cancer started in your brain or eventually moved there, you don't want cancer in the brain because of the the possibility of herniation. Okay, so again, some of the symptoms, as you can see right in here: heart attack, high blood pressure, headaches, things of that nature. Okay, breast cancer. All right, 2 leading causes of death for those with breast cancer are venous thrombosis, all right, and pulmonary embolism. Right. So pulmonary embolism is basically when a blood clot travels to your lungs, right? So both of these conditions come from blood clots. Since one of the many things tumors do is secrete a substance that increases your ability to clot, your risk of life-threatening blood clots increase. Okay, so now we're talking about, hey, cancerous tumors they love to make your body clot more than it needs to, and if clots get in the wrong spot, now we have trouble, and that could be something else that could cause issues, right? Some of the other ones they mentioned here, and I don't want to be too long here with this page, but cervical vaginal cancer, gastrointestinal tract cancer. Obviously, we need our GI tract. Obviously, lungs, we need our lungs, okay? So again, that's kind of some examples of areas, right? I'll do a little bit more on that in just a second. But again, how do we even figure out stages, right? How do we figure out when we're at the end, okay? So again, there's this, and I tried to practice saying this before I got on. I was like, let me make sure I practice saying this so I don't make a fool out of myself. But Karnofsky is what I think it is. Karnofsky, all right? The Karnofsky performance scale, all right, gives a score between 0 and 100, identifying whether the body is functioning normally or if the normal function is impaired. A person without any medical concerns will receive 100, okay? When a provider signals a score below 30, which identifies their patient as requiring special assistance. So again, they're just giving you a score based on how severe cancer may be. And then you also have the palliative prognosis score. This looks at the objective state of a person is in, and is more about statistics. They'll be looking for symptoms such as lack of hunger, along with the presence of white blood cells, lymphocytes, etc. All right. So again, we're just talking about some of the ways that we can classify cancer. So again, speaking of stages, right? What do these stages mean, right? You might have heard this on TV. Unfortunately, some of you might have heard this from, a family member or a friend that actually has gone through this or is going through this, right? So stage 0. Stage 0 as far as cancer goes. This means cancers or tumors are where they originally developed, okay? It means they haven't spread. So where, if you found cancer in your mouth or your throat or your lung or wherever it might have been, your liver, wherever you might have found it, that's where it still is. It hasn't really done much more after that. It's still kind of hanging out there, and that's where it is, okay? So as it says here, this stage is highly curable, often through surgical removal of the tumor or the cancerous cells. All right, so stage 0, hey, obviously nobody wants any stages, but if you're going to find out about cancer, stage 0 is obviously the stage you would want to be in, okay? Stage 1. So this is often called early stage cancer. Stage 1 cancers or tumors are small and not deeply embedded in surrounding tissues. They also have not spread to other parts of the body or the lymphatic system, okay? And of course, if you don't know, your lymphatic system is highly involved in your immunity and fighting infections, okay? So people with 0 to 1 may not notice any symptoms, okay? And that's another reason, if I can just, real quick, I don't do this often, but what we just talked about there a second ago is just another one of the reasons why it's super important to make sure you get your regular checkups, right? Now, I'm not a huge, those who know me, those who have worked with me, or those who follow me, or friends of mine, I'm not a huge proponent of saying, hey, anytime you have a headache, go to the doctor, right? I'm not a proponent of a lot of that, right? I prefer to focus on doing healthy habits and practicing nutrition and exercise and meditation and sleep and things like that to keep your body as healthy and as well as possible. But it is important to regularly go ahead and get your checkups, get your lipid panels done, get your blood pressure checked, get your lymph nodes screened, right? Et cetera, et cetera, et cetera. Get all of your glucose checked, all right? Get all those things checked, because sometimes when those things are out of whack, liver enzymes, right? There's so many different things you can get done when you do your regular check. And sometimes those things can tell a doctor, hey, something's not exactly right. And maybe they will go and look for something further, all right? And if you're going to find out about cancer, you're going to want to find out about it early. Okay? You're going to want to find out about it early. So, again, let's keep moving on. All right? So, again, the reason why I did that little talk to the camera moment is very simple. You may not notice symptoms if you're in the early stages. So you may feel perfectly healthy, but others may experience symptoms or notice changes in their body. And I'm not going to go through all of these, but it's just different things that you may notice. Blood in the urine, right? Abdominal pain, reduced appetite, headaches and seizures, vision or hearing changes, etc. So these are things that we can experience anyway. So it doesn't mean, hey, if you have nausea and vomiting, which that can happen to anybody, that doesn't mean that you have cancer. But again, you don't want these things to be recurring. And this is just a list of things that can happen, right? Stages 2 and 3, all right? So stages 2 and 3 cancers and tumors tend to be larger and have grown deeply into surrounding tissue, right? So that means if it's the liver, let's say the cancer started in your liver, well, now it's not just only localized in your liver, it's starting to affect other areas that surround your liver, right? It could be affecting your intestine. It could be somewhere else. So it just depends on how, again, all cancer is not the same. It just depends on how aggressive it might be. So again, stages 2 and 3, they may have also spread to other parts of the body or even the lymphatic system, and that's not what you want, okay? So now, as you can see, we're stepping it up a little bit in severity. So what is it? Stage 4. So stage 4 is also called metastatic. So metastatic means that it's spreading, metastasis, right? When you hear that word, metastasis, metastatic, right? We're talking about it spreading throughout the body, right? Or different specific parts in the body. Sometimes it's called advanced cancer. At this stage, cancers or tumors have spread to other parts of the body. People with later stage cancer will experience different symptoms depending on the type and the location of the cancer, but nobody can entirely predict factors such as, what will happen at the end, how long until the end, whether or not death will even occur. All right, we don't know. Okay, sometimes people come back from this. All right, sometimes, but not often. Right. So again, I'm not going to go through the entire list of symptoms, but these are some of the symptoms that could be seen, as it says here: drooping lips, appetite loss, requiring help with basic activities, spending most of the time sleeping, not having a lot of energy, blood pressure starts to drop, etc. Okay, so these are kind of going through the different stages, and again, how this can actually kill you. Right, once you get to this point where the cancer is moving on, or even 3 or 4, you don't want to be there. Okay, so again, if you're gonna catch cancer, here's where we want to be, and this is why it's important to get your checkups regularly. All right. So last but not least, I wanted to show you all this list. No thanks. I want to show you this list of some of the deadliest cancers, right? And some of these, depending on who makes the list, you could take one off and move another. But anyway, I did find this, and I thought this was a pretty good comprehensive list, right? So again, just like it says in the title of this article, any kind of cancer is awful. Okay, you hear the word cancer. We talked about that already. But these are some of the worst ones. Okay, see if we can scroll. Where is the first one? So it starts out with pancreatic cancer. Okay, and if you're not sure, your pancreas is highly important. Not to say that other organs aren't highly important, but your pancreas is what regulates your blood glucose. And if your pancreas is not functioning, your glucose could be running amok. Okay, your cells don't know what to do with energy. They're not getting what they need. It's not a good situation if your pancreas is not working, and you can't live without your pancreas, right? So again, pancreatic cancer begins in the tissues of the pancreas, like we said, which aids in digestion. Okay, so digestive system cancers in general are quite deadly. Okay, with fewer than half of the patients surviving 5 years. So it says your 5-year relative survival. That means if you get diagnosed with pancreatic cancer, the percent that make it 5 years is 11.5%. That's not high. So again, that's not a good one to have. Okay, so it's important. And, this kind of gives me a quick little nugget to kind of plug on your diet, right? And I know this video isn't necessarily about prevention. I'll make a cancer prevention video at a later date. But we got to make sure we're doing the things to take care of our pancreas, right? If we're flooding our body with the wrong foods and making sure we're overworking our pancreas, who knows what the connection is between that and developing pancreatic cancer. So again, sounds like a video to do. But anywho, all right. So we got mesothelioma, okay? And so the mesothelium is a layer of cells that line certain cavities of the body and then surrounds internal organs. So we're talking about kind of like protective layers of organs and organ tissue, right? So according to, mesothelioma is a cancer of these cells. 3 out of 4 mesotheliomas develop in the mesothelium that surrounds the lungs, which is called the pleura. So now we're talking about membranes that surround your lungs. This type of cancer is called pleural mesothelioma. So again, if we're talking about this type of cancer, your 5-year rate of survival is 12%. Again, we're talking about things that are important. You don't want to have issues with the surrounding areas of your organs. Your organs everything's connected in our body, but our organs do have these things, they do have boundaries, right? There's things that are supposed to be in your liver that shouldn't be in your lungs. There's things that should be in your lungs that shouldn't be in your intestines, and so on and so forth. So everything's connected, right? No matter what we do, as it says, as above, so below, as it is in, as it is without, etc., etc. So everything's connected, but they also have boundaries, your organs, and some of them, some boundaries need to be respected. And this is an example of, hey, we're having issues with the surrounding areas of our organs, all right? Gallbladder, all right, this is another digestive system organ. So again, anytime you're having an issue with organs that play a role in processing energy and nutrition, you're going to have an issue. Okay, so gallbladder again, 5-year relative survival, 19%. Esophageal cancer, again, this is part of your digestive system. All right, if you're having issues with your esophagus, you're having issues getting food down to your stomach, right? As it says here, the esophagus is the muscular tube that transports food from the throat into the stomach. Okay, if we're having issues with that, we're not intaking food properly, again, we're going to have lots of problems. 5-year survival rate, 20%. What's next? Liver and bile duct cancer. Again, you see how this is digestive system, digestive system, digestive system, digestive system. So we've gone over 4 different digestive systems, cancers. So we don't, like it already said in the previous, one of the previous ones, we don't want to have cancer in the digestive system, right? Liver cancer is one of the most common forms of cancer worldwide. It's uncommon in the United States, but it's been on the rise. The most significant risk factor for liver cancer is chronic hepatitis B or hepatitis C infections. These are transmitted through body fluids, blood, and semen, right? So again, your liver, you can do liver transplants where you can take part of a liver and everything, but again, we only have one of them, and it plays a big role in digestion. It plays a big role in filtering out poisons and toxins, so can't live without it. Lung and bronchial, so now we're talking about our respiratory system. So obviously we know we need to take in oxygen, we need to expel carbon dioxide, and obviously your lungs, your bronchi, your bronchial tubes, they help facilitate that. So again, 5-year survival rate, 22%. Pleural cancer, all right? So pleural cancer occurs in the pleural cavity, the space within the chest cavity, but outside the lungs. Let's see, where did it say? So yeah, that's what I was looking for. Sometimes this can be mesothelioma. We already talked about the seriousness of that one again. So we're talking about areas that are around, sitting outside the lungs here. So 5-year survival rate, 22%. Okay. Acute monocytic leukemia. So leukemia is blood cancer almost. Okay. Leukemia affects the blood forming tissue like bone marrow, right? So you've heard of leukemia. I don't know, need to go into too much detail there. 5-year survival rate, 25%. Brain cancer, we already talked about, 33% 5-year survival rate. Okay. Another one with leukemia, again, if you have issue forming proper blood cells, specifically with your white blood cells, leukemia, leukocytes are your white blood cells. That's the connection. Again, you're going to have problems there. All right. So again, those are some of the worst cancers to have. Obviously, nobody wants any cancer, but if you hear, if you get a diagnosis of any of these, you're going to want to act fast and start changing your body, changing your health practices, start treatment, start your therapy immediately with these specific types. All right. So that's all I got for y'all today. We'll do another one. We'll get into part 3. We'll figure out what that's going to be at a later date. But hey, as always, time for is it shameless? Is it a shameless plug? Or is it full of shame plug? I don't know. But anyway, keep in mind that I am trying to hit 200 humble beginnings, right? Humble beginnings. I'm going to look back at these videos one day and I'll be like, man, remember when I was trying to hit 200 subscribers, right? So that's where I am. So trying to get up to 200. So again, if you're seeing this video, subscribe to the channel, all right? Plenty of awesome content here on the channel. As it says here, this really truly is your number one source for health, fitness, and nutrition education, right? I'm going to break it down. I'm always going to break it down. If there's a topic that needs to be discussed, if there's a topic that you're interested in, there's a topic that you want to learn more about, something that's affecting you, I pretty much probably covered it. And if not, I'm going to cover it at some point. All right. So again, make sure y'all subscribe to this channel. Notifications turned on. Like the video, share the video out, all right? So that's me. As you can see, as we scroll through, look at these different topics real quick, y'all, that we've talked about. As you can see, I'm literally live right now talking about why cancer kills. I talked about hydrogenated oils the other day, all right? Here's a series where I just started, where I actually watch commercials based on health and medical information, and I break them down and so you can understand exactly what's going on, right? What about this one? Should you use whey protein, right? What about healthy foods you don't know about? This one's about nutritional yeast. What if you're interested in starting to do bicep curls? How you do those, right? Benefits of massage, okay? What about pre-workout nutrition? Do you need to know about that? Hey, here's a secret on weight loss. What about how to do planks or bowel movements, right? What's important about those? We could go on. Oh, here's a good one. Better health equals better sex. All right. Anytime you say the word sex, people start listening. Watch this. Sex. All right. But anyway, so lots of content here on the channel. And also you can go to fitnesscharles.com and you can see where you can go right here to book a consult. If you want to talk one-on-one, I actually have a special going on right now. It's super crazy. You can see here for a 30-minute consult, that's normally the going rate. Right now, I have a 90% off deal I have 2 more spots available. Okay, I have 2 more spots available. So if you check this out and you still haven't booked the spot, hey, drop a comment on this video that says pick me, and then we'll go from there and get you rolling. All right. But it's 90% off. That means it only costs you $5. Like, you know what, even when I say it out loud, I'm like, I shouldn't be doing this, right, at all. But again, I have 2 more spots available. It's only $5 right now where you can book a consult and we can talk about anything. We can set up your plans. We can get your programs going. We can answer your questions so that you can make better strides with improving your health. All right. So again, all the instructions for booking consults are right here on that page. And then also keep in mind that you can get started with 3 times the burn right here. Right here, I tell you exactly. I always put my prices right here. Like, I don't hide anything, right? There's a little video where I break down exactly how 3 times the burn works. That's me talking. Look, my hair is a little bit shorter, but that's me. So anyway, make sure that you are following me on, as it says here, Facebook, Instagram, YouTube. Again, subscribe to the channel. Follow me on Twitter. Oh, you can't see those, huh? Let's see. How about that? Facebook, Instagram, YouTube, Twitter. All right. Everything is Fitness Charles, except YouTube is Fitness-Charles because somebody took it. Who are you? All right. But anywho, that's how you can get into contact with me. All right. But until next time, I will check y'all later. As always, please be happy, be healthy, and be fit forever. See y'all next time.